sound check. Brian Alston, can you hear me? Thank you. I'm muted. Oh. Yes, I could hear you.
I want to welcome everybody. I am reconvening our Cook County Health Special Finance Committee meeting, which originally opened on July 26th, was continued to August 2nd, and continued today. So we are reconvened, and I'm going to ask the Secretary if she could please call the roll.
Director Harrington?
Present.
Director Robinson?
Present.
And Chair Ryder?
Ryder is here.
I think the directors was participating remotely. Get your name up there.
No.
Oh, okay.
I do expect Director Bott and potentially Director Webster Cross to
Okay.
remotely join.
We will
Put
note,
a name up there.
we'll note them for the record. But we do have members, I think we have all the members of the committee are here.
We do.
Okay, all right, perfect. As I said earlier, this is a reconvened meeting. The special meeting that's being held for purposes of public presentation and to take public testimony on the Cook County Health System budget. We will be first hearing from our Chief Financial Officer, Pam Casara, to walk us through the budget as we've done as we did at the last hearing. Thank you, Pam.
Thank you, Chair Ryder. Good evening, everyone.
Good evening.
So we'll start again by going through our fiscal 24 accomplishments and 25 key initiatives. Then we'll do a brief overview, a historical overview, touch on the FY25 budget, the special purpose funds, and wrap it up with our appendix of abbreviations. All right, so first we like to start with a look at how we're doing this year. So as a reminder, we try to align everything we do around our strategic pillars: patient safety, clinical excellence and quality, health equity, community health and integration, patient experience, growth, innovation and transformation, optimization, systemization and performance improvement, workforce talent and teams, and fiscal resilience. And there are many non-financial achievements listed here, but the ones that most impact our financial performance and the budget are the items around expanding services, improving operations, or reducing waste and expenses. And I won't read all of these to you, but a couple call outs. On the left, the top point mentions entering into value-based contracts, which will give us increased reimbursement. On the right, the items on the upper right, opening the neurocritical ICU, launching the Cook County Health Express Care, expanding telehealth at CERMAC, again, all increasing volumes. The second bullet around capital equipment also helped to increase volumes as well, as we had no downtime related to broken equipment. And then that bottom bullet, revenue cycle turnaround plan, continues to increase our collections and reduce denial so that we can reinvest those dollars into services to our patients. Next slide. So looking ahead to FY25, you'll see more of the same. Generally, we're looking to continue on the path we've started over the last few years through a combination of expanding services or decreasing expenses through standardizing, centralizing, or consolidating. A couple call-outs on this page. On the left, there's a few comments around continuing to grow the service lines and behavioral health initiatives. And then on the right, continuing to expand at Provident and our new Bronzeville Health Center. And you'll see a lot of words again like optimization, streamline, again, looking to increase throughput and or reduce expense in FY25 so as to remain financially viable in the years ahead. Next slide. So for a quick historical overview, on this slide, you'll get some perspective and you can see the trends over time. And this is important as we build our annual budget. We start with volumes. You can see that since the FY20 dip related to the pandemic, all key volumes are showing slow but steady growth. Next slide. And this is our where we've been and where we're going slide. You can see going back to 2019, we had a pretty big negative or deficit of nearly $500 million. But we've enjoyed surpluses the last few years, driven by the pause on redetermination during the pandemic as people were able to retain their insurance coverage, in addition to the Medicaid expansion to our resident immigrants, strategic service line growth, and good fiscal management. Additionally, on this slide, you can see the lines coming together in FY25 to zero, in other words, a balanced budget. And then in the out year projections, the expenses start to exceed the revenue. However, management would be expected to address any projected deficits through a combination of revenue growth and or expense reduction. Next slide. This slide shows our budgeted FTE trends over time, which is also important as our salaries, wages, and benefits comprise over 51% of our operating expenses. In most recent years, FY21 through 23, the increases were related to expanding services around their specific strategic initiatives, addressing the needs related to COVID and the asylum seekers or new arrivals. And then last year, there was a decrease where we implemented a 308 FTE reduction of vacant positions only that was related to an exercise around productivity, benchmarking, and right-sizing the organization. And then for FY25, we budgeted flat or the same as FY24, so no additions nor reductions. Next slide. So on this slide, we have our base budget assumptions. The overarching goal of the budget process is to come in with a balanced budget, which means our expenses cannot exceed our revenues. And since volumes and membership drive the revenues, we start there, so we know how much expense we can cover. We begin with the current year actual projected volumes and add or subtract for known impacts from there, as shown on this slide. And again, FY25 budget is basically a continuation of strategies we've been working on the last 2 years, especially around growing services at Provident and continued ramp up of the cardiac, neuro, and cancer service lines at Stroger. Next slide. This one shows how that thought process translates into numbers, and these are the key volume statistics that drive the budget. So again, we look back, we look at current year and whether or not we're meeting the budget, and then we look forward to the next year's budget. These volumes represent very reasonable and achievable growth based on current year run rates and planned strategic initiatives. Next slide. Which brings us to the proposed FY25 budget of $5.146 billion. First, looking at revenue, this is an $890 million or 20.9% increase over the FY24 budget, but is a reasonable and achievable $178 million or 3.6% increase over this year's projected $4.968 billion. Touching on some of the bigger variances in the breakdown, you can see the largest piece, $691 million or 78%, is coming from County Care. And we'll get into their assumptions in a later slide, but generally they've been doing so well the last few years, retaining the membership and exceeding their budget, that they went with a more realistic membership target for FY25. On the hospital clinic side, $143 million increase over FY24 budget, but a $16 million decrease from this year projected due to anticipated increases in charity, coming from both the budgeted increases in volume as well as the shift in payer mix or decrease in Medicaid related to the redetermination process. Next slide. Moving on to expenses, we are balanced at $5.146 billion as well. We'll go through each office in a moment, but the large increases here in expense are primarily also coming from health plan services or County Care and Stroger. And on the FTEs, you can see again that we're flat at 7,326 positions, no increases or decreases in total. However, there are shifts between offices that were made to achieve various strategic initiatives. All right, so starting with Stroger, going up $130 million in 8 positions. The key expense drivers for Stroger are continued ramp up of the new service line, investment for cardiology, neurology, cancer, and then cost inflation on the medical expense, lab expense, increased volumes and addition of robotic surgeries, pharmaceutical utilization, and information technology. This also reflects the half-year impact of a June 1, 2025, 5% COLA increase. Next slide. Provident, going up $12 million in expense, 38 positions. Again, new and expanded service lines for Provident next year, the Crisis Triage Stabilization Center, also neurology, stroke, GI, and women's services, PT, OT, and speech, and then a new dedicated observation unit, and then also facility infrastructure upgrades and investment for the aging campus. Looking at outpatient, going up $33 million in 3 positions. This is key drivers here are expansion of virtual care and urgent care to select clinics, our new Bronzeville 31st Street clinic opening this fall, and continued health needs of the new arrivals. Next slide, correctional health, going up $12 million, going down 6 positions. The key drivers here are telehealth phasing expansion, maximizing use of technology, and then the reduction in FTEs reflects staffing and programmatic realignment under the Office of Behavioral Health to meet the clinical needs of increased mental health demands. Next slide. Public health, going up $2 million and 2 positions. The drivers here are the communications initiatives for expansion of advertising of the CCDPH services to the public, and then the new Broadview warehouse facility for vaccine distribution. In health administration, going up $35 million and down 47 positions. This is driven by the continued investment in revenue cycle, HR, supply chain functions to increase revenue, expand hiring and optimization, and drive operational efficiency. And then continued expansion of the life sciences department to support research, and the reduction in positions reflects transfers from the position control committee pool to other offices to achieve their strategic initiatives. County Care. County Care has the largest increase of $662 million and only 2 positions. Their expenses entirely driven by the membership increase from the prior year budget, which we used an average membership of 392,301. The revenue per member per month is expected to increase due to utilization cost trends and program changes. Medical loss ratio estimated at 93.6%, and then all other expense in line with prior year. This slide just illustrates the projected membership over the course of the years we've seen in the past. Again, 392,301 was the average used. And if you see those numbers, they're much smaller, more realistic decreases, just a few thousand member each month decreases over the course of the year as a more realistic projection. Next slide. This slide shows the projected membership for each population in the plan and the contribution or net gain or loss by each plan. The total $142 contribution margin average equates to approximately $56 million positive to the health system coming from both the domestic spend, which is the county care patients that use CCH facilities, and the net income of the plan. All right, moving on to special purpose funds. Special purpose funds and grants are additional monies on top of and not included in the $5.146 billion FY25 health fund budget we just reviewed, but are an essential part of how CCH is able to continue to provide needed services beyond the traditional healthcare, hospital, and clinic settings. These grants broadly categorize and address such issues as behavioral health, opioid and substance abuse, food as medicine, COVID-19 and emergency preparedness, trauma-informed treatment, and healthy communities and families. And for FY25, you can see we'll have almost $100 million comprised of over 85 separate grants and 350 additional FTEs to help us carry out this important work. Next slide. And since ARPA is almost half of the $100 million on the previous slide, ARPA is the American Rescue Plan Act of 2021, which included $1.9 trillion of federal stimulus funds to hasten the recovery from COVID-19, and of which Cook County received almost $1 billion, who in turn designated $179 million to CCH for various initiatives categorized here. So we're about halfway through the award period. We would hope to be about 30% expended. We're currently at about 26.5, but should soon bypass that with the recent Stronger Together subrecipient awards, totaling $45.3 million, targeted at resolving behavioral health inequities across Cook County through expansion of access for early intervention, prevention, treatment, support, recovery, and crisis assessment. And that concludes our FY25 budget presentation. I'd like to thank my entire finance team and especially our budget director, Joe Francois, and my associate CFO, Scott Spencer. And with that, I'll turn it back to Chair Ryder.
Thank you, Pam. I'd now like to begin receiving public testimony for those folks who've registered to speak or those who are attending with the hopes to speak. We'll try to meet all those hopes.
And for the record, Director Bott is remotely joining us.
All right, great, thank you. Debbie, do we have any speakers that are registered?
We do. We have 9.
We have 9 speakers.
Mm-hmm.
All right, great, exciting.
So the first speaker is Karen Foley, followed by Marilyn Render. You each have 3 minutes. Once you hit the 2-minute mark, I'll give you a reminder that you have 60 seconds left.
Karen Foley, Protective Association, JPA, founded in 1901 by James Hannon. Our mission has always been focused on the well-being of children. Today we are involved in the mental health field. The Stronger Together grant is an extraordinary opportunity for us to collaborate with the county to provide for equitable access to mental health services in 2 of your target neighborhoods, North Lawndale and Humboldt Park. Specifically, this grant will allow us to increase the number of children who've received therapy throughout the year in 8 school-based settings, including having Spanish-speaking therapists for newcomers, increase the number of educators who will participate in our Connect to Kids program. That's a trauma-informed consultation, year-long program for teachers to help them build more positive relationships with children, especially those with very challenging behaviors, thereby allowing everyone in the classroom to learn. To offer an intergenerational program that we call the Grandparents Circle, aimed specifically at middle school girls who are at higher risks of suicide, suicidal ideation, and violence. In addition, we'll be expanding our clinic in Humboldt Park and just opened a new clinic in North Lawndale. On a combined basis, our grant will enable us to serve approximately 1,200 children and adults. In addition, for the very first time, we'll be able to collect data that looks at the impact of providing multiple services. So, for example, if a student is receiving therapy in school, will it make a difference if that child's parent can now receive therapy in the clinic? We'll be sharing this data with Jennifer Brothers and the other members of the Stronger Together team, and our hope is that the data will provide us with the kind of evidence we need to secure funding for our work even when this grant ends. Let me conclude my remarks by sharing with you some of the most important voices I think you'll hear from today. These are real kids in Cook County that we've been serving. When we ask them about the importance of therapy to them, here are just a few of the things that they said. It's a place to talk about stuff you don't tell anyone else. It's helpful because I need to talk about how my life is going. It helps me heal sadness and anxiety from my losses. It's very good. It helps me by learning I don't have to argue all the time. It helped me get rid of suicidal thoughts. It made me more confident. It made me less shy. I can talk about situations, and if I don't talk about bad situations, I'll probably do something I regret later. And finally, as one young lady announced, because of therapy, today I'm an upstander, not a bystander. I hope these voices will give you some extra confidence that this incredible grant will change the lives of children in profound and positive ways and also support the adults who care for them. So on their behalf and on behalf of all of us at JPA, I really want to thank all of you in Cook County for including JPA in Stronger Together. Thank you.
Next speaker.
Next speaker is Marilyn Render, followed by Linda Schuler.
Good evening, everyone. I wanted to say I'm a member of your Providence Hospital as well as your Inglewood Health Center's Advisory Council. I work with Marcelino Garcia, Alice Collins, and Caitlin Long. We are the boots on the ground as the Advisory Council. So we get a chance to work and see the unique and distinctive members who are part of the Cook County Health System who desire, need, and benefit from these outstanding services that the system gives them. So I'd like to say thank you wholeheartedly because we are the boots on the ground. We are representing people who some people say they never felt better by coming and being a part of the Cook County Health System. The services are outstanding, and I thank you for continuing with that. I've had a lot of people come to me to say, I don't know where I would be without the Cook County Health System. As you know, during COVID, a lot of people lost their jobs, and it was just that safety net, knowing that someone still cared about the health and the importance of making sure not just the health, but all of the communities that are involved in making sure that individuals who are a part of the Cook County Health System are safe, and they are not just for themselves, but for their families. So again, I thank you, and it is a pleasure to serve with you. Thank you.
Thank you.
The next speaker is Linda Schuler, followed by Andrea Munoz.
Good evening. My name is Linda Schuler, and I am the CEO at Housing Forward, a nonprofit organization whose mission is to serve people who are experiencing a housing crisis and move them to housing stability. For 32 years, we have been providing comprehensive programming for those in West Suburban Cook County. Since 2016, Cook County Health has partnered with Housing Forward to address the intersection of housing and health for unsheltered and precariously housed patients. The leadership of Cook County Health fully recognizes that you can't be healthy without stable, safe, secure housing. Without stable housing, sickness and chronic conditions worsen. Untreated symptoms mean a preventable disease can easily lead to a shorter life expectancy for someone without a home. Cook County Health has been a critical leader in breaking down barriers with direct investments in medical respite and housing supports for its patients and county care members. These new models of care have been transformational. directly impacting how the health system interfaces with organizations like Housing Forward to meet the needs of mutual clients who lack the stability necessary to maintain their health. The RISE Center of Cook County, the county's medical respite program in partnership with Housing Forward, is one shining example of filling a critical need for those who are homeless and need recuperative care after discharge from the county's health system. The RISE Center offers medically supported temporary housing to individuals and families experiencing homelessness. Over 300 people experiencing homelessness have been served by the RISE Center since 2020. The program has been a critical intervention to avoid inappropriate use of nursing homes while lowering client access barriers to medical care. Cook County Health has also invested in a new housing navigation program to provide necessary housing supports for Cook County Health members who are precariously housed, who are unsheltered, and need access to safe, affordable housing options for which Housing Forward is a partner. The Cook County Department of Public Health, through its Building Healthy Community initiative, is also investing in outreach and housing supports for those who are homeless and struggling with chronic addictions, particularly those affected by the opioid crisis.
Excuse me, 2 minutes have elapsed.
Okay. Cook County supports 2 of our housing programs for county care members who are chronically homeless, whose incomes are below 30% of area median income. Housing Forward is also the suburban partner in the flexible housing pool, which also serves as a critical intervention for high utilizers of care. In total, Cook County Health, County Care, and the Cook County Department of Public Health combined investments of $6 million in multiple year contracts with Housing Forward. We need Cook County Health System's continued partnership with Housing Forward and other partner agencies like ours to tackle homelessness. We cannot do this work alone. We strongly support the upcoming budget. Cook County Health will continue, and we hope that you all will continue to make the groundbreaking investments and work towards a future that ends homelessness for those with critical health needs. Thank you.
Thank you.
The next speaker is Andrea Munoz, followed by Beulah Brent.
Good afternoon to all of you, and thank you for the opportunity for the community to be present. My name's Andrea Munoz. I've lived in the Little Village community for about 50 years now, and have been engaged with the Prieto Ambulatory Health Center in Little Village since its inception. Recently, we were the first of the clinics away from the medical district, and we were the first that developed its own community board. This past year, our community board had to dissolve itself because we were aging out. We've been engaged so many years. And I'd like to thank the community affairs group who stepped in and created an advisory board that continues to include folks from community organizations. Little Village is the second most densely populated community area in Chicago. It's the largest concentration of Mexicans and Mexican Americans outside of Los Angeles in the country. We're the youngest community area. And so we also have a very significant portion of our neighborhood population that are undocumented immigrants. And we, in addition to the long-term undocumented folks that live in the community, we have a shelter in the community for the more recent migrants from Venezuela that were bussed up to Chicago. So I want to speak to the importance of having the family medicine services available in the community in a language that people can use and access, and kind of reinforce to you how critically important that is for the neighborhood. It's somewhat of a concern that the staffing has been reduced without the same number of doctors, you can't see the same number of patients. And so I think that's somewhat of an issue in the community. We have additional services at the clinic that are greatly appreciated and needed. We do have our own mammography services as well as dental services that were added a few years ago. So I just want to say thank you for the services and tell you how important and how critical they are to my community. Thank you.
Thank you.
Thank you. Our next speaker.
The next speaker is Beulah Brent, followed by Samuel Mulrow. Beulah Brent is not present.
It does not look like Beulah has arrived.
Samuel Mulrow, followed by Robert Mapes.
Good evening, everyone. My name is Sam Mulrow. I'm here from A Safe Haven Foundation, and I'm really appreciative of the opportunity to come here and speak with you today, in particular about, to express our gratitude for the recent funding made available through the Stronger Together initiative. This generous support is not just a financial contribution, it's a critical opportunity for organizations like us to build a program that will surely enable our clients to restore hope and long-lasting opportunity within their lives. One thing that I really wanted to note about this particular funding opportunity is it's so cool to have a chance to innovate around evidence-based, evidence-informed practices, and to have a grant come out that has very clear objectives and populations to serve, but still allow us as the organization to say, okay, we can take this over, the last 10 yards with this population in particular, and we know how to best, or we think we know how to best work with our clients. This grant really offered an incredible amount of structure and flexibility, and it mixed the two very well. In addition, the administration of the process around the NOFO to award, it's those little things that really make a difference that allows many organizations to apply competitively for these opportunities, to be able to put their best application forward, and for the county at the end of the day to pick the best projects that are going to serve the members of the county. So from that standpoint, it was really appreciated how well that was put together. Early indications are that the team that's administering this grant also have the same level of excellence around the grant administration, working collaboratively with key performance indicators and holding us accountable to the things that we said we're going to do, but also partnering with us to achieve those things. So really from beginning to where we're at right now, because we're not at the end, it's closer to the beginning, really appreciative of the opportunity from the county. To that end, we were able to build a program, or building a program that we're implementing that's going to work with persons experiencing a substance use disorder. Much of behavioral health doesn't occur within that 1 hour that is in the clinic that week, or within those 9 hours that are in that IOP that week. And having the opportunity to build a program that can mix in both substance use disorder and adult education, vocational training, employment services, placement, all around one care team that has that client in mind is really a cool opportunity, and I can't wait to see this program over the next few years. So thank you for, one, an incredible process, because I like a good process, I think everyone does, but two, just the way that all this has come to fruition so far has been really awesome from a community-based organization perspective. And I applaud all the others who were awarded the grant too, and we look forward to seeing your great work. Thank you.
Thank you.
The next speaker is Robert Mapes, followed by Nicole Kazee.
Good evening. My name is Robert Mapes. I'm the Director of Program and Community Support at Age Options. We are the Area Agency on Aging of suburban Cook County. As a role of the Area Agency on Aging of suburban Cook County, we plan, fund, coordinate, and advocate for services for older adults. We've been working with the Cook County Department of Public Health for more than 15 years in a very collaborative space. I'm here to support the budget as proposed for the Cook County Department of Public Health. We've been really appreciative of the way that they have worked within their community and with us with an equity approach to improving the health of the community. We are currently funded by them under two community health CDC grants, the Community Health Worker Grants and the Health Equity Grants. Under those grants, we're able to expand our reach and impact in particularly in health disparity communities and low-income communities, And we've been able to engage other organizations that are able to expand that reach even beyond with a health equity approach. We really worked closely with the Cook County Department of Public Health during the COVID time when the vaccinations were dire and needed for older adults. They were active and eager partners in us bringing those to older adults within our area. We look forward to continual collaboration with the Cook County Department of Public Health. We see them keeping a strong, proactive eye on improving the health and the health equity of our community. Thank you so much for your time. Appreciate it.
Thank you.
The next speaker is Nicole Kazi, followed by Mohammed Paracha.
Thank you. My name is Nicole Kazi, and I'm the Chief Strategy and Transformation Officer at Erie Family Health Centers. Erie is a network of community health centers that provides primary medical care, behavioral health care, dental care, and more at 12 locations in Cook County. We serve over 90,000 people and take all patients regardless of ability to pay, insurance status, or immigration status. We, like Cook County Health, operate under the firm belief that healthcare is a human right. I'm here to talk about the value of county care and the Medical Home Network Accountable Care Organization, or MHN-ACO. Medicaid is our largest payer, and county care is our largest Medicaid plan, with over 27,000 county care patients assigned to Erie as their medical home. We believe that county care is the best Medicaid plan for our patients. It offers the most extensive benefits, waives out-of-pocket costs when possible, and provides the most support. On top of this, Erie's county care patients get extra benefits because we are part of the Medical Home Network, ACO. This partnership allows us to provide care management services at Erie. When we, as opposed to the health plan, employ the care managers, they are part of the care team, working alongside the doctors and other staff. The care manager's work is in our record along with the patient's other medical information. We truly believe this improves patient outcomes for many of our highest risk patients, and it is only our county care patients who can get this service at Erie because of the MHN partnership. Our partnership with county care through the MHN-ACO has also helped us focus our quality initiatives and rewarded us for doing the right things for our patients. And when our work leads to reduced hospital stays, emergency department visits, and other things that cost the system money, we've been able to share in some of those savings to further build a system that truly helps people live their healthiest lives. One of the biggest threats to coverage over the past year, as you've just been hearing from the CFO, was the Medicaid renewal process, which started again after a 3-year hiatus during the public health emergency. County care did the most to support our ability to assist patients with their renewal. And MHN took this to another level, providing data reports that we weren't receiving for any of our other Medicaid populations, which allowed us to target our outreach to the right people. It's hard to explain how important this has been. We all know patients are better off with insurance coverage than without. But at safety net organizations like ours, and like Cook County Health, when people lose Medicaid, they often become uninsured. Insurance payments are how we keep the lights on. Thank you for continuing to support county care and the MHN partnership. It's a win for the county, for safety net providers like Erie, and for the people who live here.
Thank you.
And the final registered speaker is joining us remotely, Mohammed Paracha. Mr. Paracha?
Hey everyone, my name is Mohammed Paracha. I'm the CEO of AHS Family Health Center. We are an FQHC with 4 health center sites located on the north side of Chicago and in the northern suburbs of Cook County. I'm here today to offer my testimony in support of the county budget for Cook County Health and the County Care Health Plan, which continues to be a well-recognized health plan among patients and providers delivering healthcare services in Cook County. My health center employs 110 staff. Most of them are bilingual. Our staff speak over 40 different languages to ensure that we fulfill our mission of providing culturally competent and linguistically appropriate services to multilingual patients residing in our service area. We serve more than 15,000 unduplicated patients annually. More than 90% of our patients resides in the county of Cook. More than 2,000 of our patients are county care members. 30% of our patients are uninsured. AHS Family Health Center joined County Care back when it started in 2013, and we joined Medical Home Network that provides care coordination services to county care patients in 2021. I have mentioned this in the past that through this valuable partnership between County Care, medical home network, and FQHCs, we were able to prevent duplications and improved health care outcomes of our patients. In addition, this partnership was able to control cost of care in uncertain times, especially over the past few years and during the COVID-19 pandemic. Regarding redetermination and renewals, just last week, my chief medical officer told me about a conversation between her, one of the OBGYN physician, and a patient navigator when patient in the exam room was uncertain about which NCO to enroll in. And I'm paraphrasing here, the OBGYN asked the CMO, which insurance would you recommend? Who responded swiftly that physicians prefer county care because it offers best coverage to the patient and it is accepted by most specialists and hospitals in Chicagoland area. This and many such conversations that take place at our health center reflect on when provider preferences align with patient needs and insurance company values. This guarantees better health outcome for the community. This is evident by the top quality ranking county care received from state HFS. Thank you for your consideration and the support you provided to Cook County Health and County Care. This concludes my testimony. Thank you.
Thank you. Do you have any other speakers?
We do not.
We don't have any more registered speakers virtually or in person. Is there anyone else here who'd like to offer public testimony? Anyone? 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 Okay. All right. With that, this is our second of our 2 scheduled public hearings, correct, Debbie?
That is correct.
All right. Now that we have exhausted all of that, we do have a regular Finance Committee meeting, which is scheduled for a week from this coming Thursday, where we'll be offering an additional, because it's a regular meeting, we always have public comment.
And at the board.
And then we'll be considering the budget at the next Finance Committee meeting, and then potentially submitting it to the board from there. So we have exhausted the agenda, and the Finance and I'll note that, again, that the Finance Committee will review and consider the preliminary budget at its next regular meeting on Thursday, August 15th at 9 a.m. And also take into consideration all the public comment that's been offered in these 2 hearings. So with that, again, the agenda is exhausted and we're adjourned.
Thank you.